Sophia Antipolis, March 27, 2023. Patients with atrial fibrillation benefit from early rhythm control therapy. It reduces cardiovascular strokes and other adverse outcomes by 20% compared to usual care. The beneficial effects of early rhythm control were demonstrated by the Pan-European AFNET 4 study and confirmed by other major health studies. But what is the cost of the new treatment strategy? A cost-effectiveness analysis revealed that the health benefits of early rhythm control come at reasonable additional costs. The analysis is published today in EP Europace, a journal of the European Society of Cardiology. 1. Atrial fibrillation is an emerging epidemic. It is estimated that the number of AF patients in the European Union will increase to approximately 18 million by 2060. Affected individuals are at higher risk for stroke and other adverse events associated with higher treatment and long-term care costs. This leads to an increased economic burden. The AFNET 4 study investigated whether rhythm control therapy with antiarrhythmic drugs or atrial fibrillation ablation given within 1 year of AF diagnosis improves outcomes. The main study outcome 2022 showed that early rhythm control therapy improved outcomes in patients with AF and comorbidities. Early rhythm control with antiarrhythmic drugs andor AF ablation reduced the primary outcome, which was a combination of cardiovascular, stroke, and hospitalization for worsening heart failure or acute coronary syndrome in 2,789 patients with early AF and cardiovascular risk factors, compared to normal care at 5-year follow-up. The health benefit of early rhythm control is clear. However, the cost-effectiveness of the new treatment strategy has not been evaluated so far. A concern after the publication of the AFNET 4 main study was whether additional treatment would impose an acceptable or unnecessary financial burden on health systems. In current analysis, this is the first time we have examined cost-effectiveness of early rhythm control compared to care, explains Sophie Gottschalk, Research Department for Economics and Health Services, University Medical Center Hamburg-Eppendorf, Center for Economics Hamburg, Hamburg, Germany. The cost-effectiveness analysis was based on data from the Germany subsample of the AFNET 4 trial of 1,664 patients. Early rhythm control in 832 patients was compared to usual care in 832 patients over a 6-year time horizon and from a German healthcare payer perspective. The cost categories considered in the analysis are hospitalization and medication costs, time to appearance of a primary outcome, and time to survive the observation period were used as measures of impact. Incremental cost-effectiveness ratios were calculated for each measure of impact. The ICER value defines ditional costs required for an additional year without primary outcome events or an additional life year, respectively. The analysis showed that early rhythm control was associated with higher costs up to €1,924, resulting in ICERs of €10,638 per additional year and €22,536 per year life gained without primary consequences. As shown in the uncertainty analysis, high cost-effectiveness probabilities can be achieved if the healthcare payer is willing to pay greater than or equal to €55,000 for an additional year without primary consequences, or for 1 life year gained. AFNET 4's principal investigator, Department of Cardiology, University of Hamburg-Eppendorf Cardiovascular Center, Hamburg, Germany, Professor Analysis of AFNET 4 study data for Germany. Future research examining the cost-effectiveness early or the cost-effectiveness of different modes early rhythm control in subgroups who benefit more from therapy in other countries is warranted. Since the publication of the main study result in 2020, different subgroup analyses of AFNET 4 study data have been conducted. One described different, variable treatment modalities of trial-used antiarrhythmic drugs and AF ablation, administered within guidelines recommendations. 3. Other subgroup analyses demonstrated the prognostic benefit of early rhythm control in an heart failure. 4. asymptomatic AF, 5, different patterns, 6, and high comorbidity burden, 7. And in patients with prior stroke, 8. An intermediary analysis identified sinus rhythm as a key factor for the effectiveness of early rhythm control, 9. The East AFNET 4 trial has partners across Europe, including ESC's European Heart Rhythm Association. Graphic summary notes ERC, early rhythm control therapy, ICER, incremental cost-effectiveness ratio, primary outcome event equals cardiovascular, stroke or hospitalization for stroke, or acute coronary syndrome.